Each day of the 8th International AIDS Society Conference on HIV Pathogenesis, Treatment and Prevention in Vancouver, Canada, we'll be talking with Dr. Carl Dieffenbach from the National Institutes of Health. Here are the highlights from July 21st, 2015. It's day 2 of the International AIDS Society 2015 conference. Via Skype, we're talking with Dr. Carl Dieffenbach in Vancouver, Canada. Sir, can you share some highlights from today? And I'm going to ask you first to focus on some things we learned related to PrEP.
So, my pleasure, Miguel. Remember, I talked a little bit about PrEP yesterday and how Dr. Fauci highlighted PrEP as one of the key tools in our toolbox that we can use to help control the domestic epidemic. The issue moving forward, however, is we know PrEP works, but people must access it and then take the medication. So what we were able to demonstrate today at the conference was through a series of demonstration projects performed at sites around the United States that the highest risk population, young Black MSM, women in the South, could access this biomedical intervention, this tool, use it, and move toward protecting themselves from HIV acquisition. This is a big step forward, the fact that in the past, we've had trouble getting uptake in these individuals, in these groups, and this really represented a major step forward.
Wonderful, sir. Also, there was some key news about early antiviral therapy that prevents non-AIDS outcomes. Could you shed some light on that, sir?
So that is one of the really interesting, surprising findings coming out of this meeting, is we always anticipated that antiretroviral treatment would have profound impact on the AIDS-associated cancers and diseases such as Kaposi sarcoma or even PCP, pneumocystis pneumonia. What was coming out from the meeting today was that not only are we impacting the diseases we expected, but also non-AIDS associated cancers. That is just such a phenomenal finding that we're seeing a reduction in cancers in people who receive early therapy.
Well, thank you. And again, important news I want to share with our listeners that we'll be talking with Dr. Carl Dieffenbach tomorrow, the third and final day of the conference. And if you want to learn more, please visit AIDS.gov. Sir, thanks for joining us. For more information on the conference, please visit IAS2015.org. And for more information on federal HIV programs, please visit AIDS.gov.